Hello friends, let us now learn some important points about acute epiglottitis. So in acute epiglottitis, first and foremost, epiglottitis, it is the acute inflammation. As the name says, it is the acute inflammation of epiglottis. It is the acute inflammation of epiglottis, airy epiglottic folds and arytenoids. This acute epiglottis is most commonly seen in children, that is H. influenza. It is most commonly seen in children and the etiological feature is Haemophilus influenza type B. If it is seen in adults, it is caused by adult. If it is seen in adults, it is most commonly caused by group B beta hemolytic streptococci. It can also caused by Streptococcus pneumonia, or it can be caused by Staphylococcal aureus, and even Klebsiella pneumonia can also cause this disease. If it causes Neisseria meningitis causes this acute epiglottitis, it will result in fulminant disease. If Neisseria meningitis causes acute epiglottitis, it causes fulminant life-threatening epiglottis. Okay. Then if you see the clinical features are, it is most commonly seen in children between 3 to 6 years of age, and it will also occur in adults. There will be rapid progression. Remember, the progression will be rapid. So here there will be upper respiratory tract infection with fever in the children, and in adults it is most commonly present with sore throat and dysphagia. And in children you will also see dyspnea, and this dyspnea and also inspiratory stridor is seen in the children. And this inspiratory stridor will increases when the child sleeps in supine position. And next important thing is the child prefers to sit in sitting position and with hyperextended neck. The child tries to sit in sitting position with hyperextended neck. This is called as tripod position, where the child tries to sit in sitting position and then with hyperextended neck. This will actually relieve the stridor of the child. Then drooling of saliva is seen. Voice is not affected. In adults, there can be tachycardia also. Okay. Now, what about the signs? What do you see? In the signs are epiglottis will appear. Cherry red and swollen in appearance in the indirect laryngoscopy, and care should be taken depressing the tongue for examination, because if you depress the tongue on examination, it can cause glottic spasm. So as a result, to prevent the glottic spasm, we should carefully depress the tongue. So we should always carefully depress the tongue, or else it can result in glottic spasm, or else it can result in glottic spasm. Then what about the investigations? Investigations are in the lateral soft tissue of the neck. You will see swollen epiglottis. That swollen epiglottis is seen as a thumb sign. It is seen as a thumb sign like this. Okay. Then there is also vallecula sign is also seen. In vallecula sign, there is absence of deep, well-defined vallecula is absent. Okay. Next, what about the treatment? Treatment is first and foremost, you should do intubation. Intubation is the first priority. First priority is intubation in these patients. If you were asked what is the first priority, it is intubation, regardless of the severity of respiratory distress, because it progresses rapidly. So the first priority should be intubation. Then you should hospitalize the patients. Then you should give IV antibiotics, like ampicillin can be given, or you can also give second and third generation cephalosporins can be given. Ampicillin and second and third generation cephalosporins can be given. Even you can give ceftriaxone IV is given, 100 milligrams per kg per day is given. Then you will have to give oxygen inhalation should be given to the patient, with humidification is given to the patient. Next, if you were asked what is the antibiotic of choice, antibiotic of choice is actually ceftriaxone IV. Ceftriaxone is given IV, which is the antibiotic of choice, ceftriaxone. Next, steroids are given, adequate hydration is maintained. If an unvaccinated child is in contact with this baby who has epiglottitis, then you will have to give all the members of the household, including the patient, should receive a prophylactic. For contacts, we should give prophylactic rifampicin is given for the contacts for 4 days. Prophylactic rifampicin is given for 4 days for the contacts. One important thing is, what is the most common cause of death? The most common cause of death or complication is respiratory arrest, and this respiratory arrest will result in the death of the baby. Thank you.